All right. Well, I'm Cliff Dupre. I'm with the Salute America team here at UT Health San Antonio. We're in the next webinar in our series of Let's Address Health Equity Together. Today's webinar is entitled The Importance of Diverse Biospecimens. Our moderator today is Dr. Amelie Ramirez. Dr. Ramirez is Director of Salute America and its home base, the Institute for Health Promotion Research at UT Health San Antonio. She has over 30 years directing research on human and organizational communication to reduce chronic disease and cancer health disparities affecting Latinos. And she's also Associate Director of Cancer Outreach and Engagement at the NCI designated Mays Cancer Center at UT Health San Antonio. Dr. Ramirez.
Great. Thank you so much, Cliff, and good morning to all of you. It's really a pleasure to have you join our webinar today. We all know the importance of, biospecimens, but today we really are excited about, discussing the importance of diverse biospecimens and how we can increase Latino participation in their donations. We all know that biospecimens are materials that we gather from our human body. They're sometimes called samples. And this can include tissue samples such as our hair, skin, or pieces of our organs. It also includes fluids such as blood, urine, or saliva. And these samples contain cellular and molecular and chemical information that's really important as we develop new therapies for our different diseases. Biospecimens are often come from different sources. Biospecimens are often the source of how researchers actually use to study different types of health conditions. And when people donate biospecimens, either their blood or fluids or tissue samples, it gives researchers the opportunity to better understand, treat, and prevent medical conditions from cancer to Alzheimer's for all kinds of health conditions. But not many people have heard of the importance of biospecimens. And when you say biospecimens, people hesitate. It sounds kind of mysterious. And so we really want to demystify what are the use and how biospecimens are used. Really, it gives researchers that opportunity to better understand and treat our health problems. And the biospecimens are especially needed from Latinos in our diverse populations so that new methods of treatment will help all of us. This is because the Latino population faces both a heavier burden of certain cancers as well as worse cancer outcomes than other populations. And that is true across the nation and here in South Texas. So these are some of the questions that our panelists are going to help us learn more about and dive into today. Today, we have three panelists to help us explain the importance of biospecimens, how biospecimens are used, and why should the lay public participate. So again, I want to thank our panelists today for being with us this morning. So I'm going to briefly introduce two of our panelists, and then our third panelist will start off with their remarks. So our first panelist is Dr. Martin Mendoza, and he's the director of the Health Equity for the All of Us Research Program at the National Institutes of Health. And Alma Lopez is a Latina breast cancer survivor who's also participated in the All of Us Research Program at NIH. And we're very grateful to her to share her personal experience. And our first speaker to start off our panel represents our web sponsor, of which we are very grateful to Genentech, which is a biotechnology company and a member of the Roche Group. Dr. Altavis Ewing is a clinical scientist and genomic health equity officer, and she's been a leader in this area for 15 years and doing genetic counseling and looking at health disparities research experiences. She's the senior science lead and strategist on the Global Health Equity and Population Science Program team there at Genentech. So Dr. Ewing, please, we look forward to your remarks. And why does Genentech think that biospecimens are important? And how does the pharma industries utilize this information from biospecimens?
Thank you so much, Dr. Ramirez, for that warm welcome. I'm truly grateful to be here. And as Dr. Ramirez said, I have the privilege of working with the Global Health Equity and Population Science team at Roche Genentech. And Genentech is a company that believes that health equity is achieved when everyone has a fair and equitable opportunity to be as healthy as possible. We believe that this is not only a moral obligation, but it's also a business imperative. And it's actually essential for Roche Genentech to achieve really our 2025 diversity and inclusion commitments, as well as our Roche 2030 Pharma vision. And that vision is to bring 3 to 5 times more patient benefit at half of the cost to society. So we want to be able to bring more medicines to more patients at cheaper costs. And when we reflect on our Genentech specific 2025 commitments, it really offers a roadmap for us to follow to help bring this mission to reality and make health equity a reality for all. And we truly believe that the inclusion of biospecimens from diverse, historically and traditionally underrepresented populations is critical in achieving this goal and this mission. So at Roche, our biospecimen donation and collection is actually directly derived from our clinical studies. We collect samples from patients as we run and conduct our clinical trials. And the samples that we currently have access to in our repositories come from patients and even employee participants who have participated in our Roche and Genentech sponsored trials, as well as some of our on-campus employee initiatives as well. And when we look at our current repository, what we have observed is that the current state of the diversity within the biospecimen collection at Genentech is unfortunately reflective of populations that are oftentimes characterized by privileged access to healthcare. They may be characterized by homogeneous genetic ancestry. So we see that there are more people of European ancestry reflected in our repository. They may also be people who have uniform social experiences, common geographical locations, shared cultural traits, and even similar environmental exposures. So the current assets of biospecimens that we have access to are not as reflective of the US population or even the global population as we would desire. And again, because the reality is that the majority of our biospecimens do not capture the diversity of the human experience and genetic diversity, this may actually result in inaccurate scientific and medical conclusions that risk enhancing some of the existing inequities and disparities that we observe in health and healthcare. So one of our many goals at Genentech Roche is to improve access to biospecimens that reflect the diversity of a given disease for biomarkers and even for assay development. So we're thinking about how access to biospecimens can really drive the development of future assays and future products that can help us diagnose disease and better treat disease in the future. And when we reflect back to 2018, Genentech launched an initiative called Advancing Inclusive Research, and we call it AIR for short. And through this initiative, we were able to address some of the challenges around the lack of diversity in biospecimens and also highlight the importance of representation in advancing inclusive and equitable science through representative and inclusive clinical trials. Some of our diversity efforts within our trials encompass a focus on both the research aspects and access issues, predominantly ensuring that there's access among people of non-European ancestry to our clinical trials, to our therapies, and to our products. But this is done within the overall context of ensuring that our medicines are safe and efficacious for all patients in all populations. And then this initiative also aligns with what is known as the reverse translation paradigm, sometimes called the bedside to benchtop research paradigm. And through this paradigm, this is where we see that actual real life patient experiences in the clinic and in clinical trials, it informs some of the research hypotheses that we are able to test in our subsequent clinical trials. So as a result, the human experience in clinical trial leads to the collection of data, which enables us to derive insights and conclusions, which helps us to come up with questions that are more relevant to the populations that are being studied. And if we're being very intentional about including underrepresented populations in these studies, this is how we ensure that we conduct inclusive research moving forward. Some of our additional diversity and inclusion in science initiatives at Roche Genentech also focus on building diverse data sets from populations through DNA analyses, collection of serum and plasma so that we can conduct more proteomic studies. And then also characterizing the diversity of some of the cell lines that we currently have access to at Roche Genentech. But I would say in closing, at Roche and Genentech, we are truly committed to not only being a health equity leader, but we also want to be a partner of choice because we recognize that we cannot and will not achieve health equity alone. It truly requires a genuine collaboration and partnership. So as a result, we are diligently working to engage with stakeholders across the healthcare ecosystem. And we're also building genuine and deep partnerships with communities that are disproportionately impacted by systemic inequities to help co-create lasting solutions that address the drivers and manifestations of inequities across the healthcare ecosystem. So this is from education all the way to delivery. So hopefully I've highlighted in terms of why we believe biospecimens are important and essential in our ability to conduct inclusive research at Roche Genentech. And I look forward to hearing from the other panelists and also engaging in a vibrant discussion later on today. Thank you.
Great. Thank you so much, Dr. Ewing, and for making that importance that, you know, we need to be conscientious of all the different steps, you know, from the education to the entire process in terms of how our biospecimens are utilized. So thank you for those wonderful remarks. Our next speaker is Dr. Martin Mendoza, and Dr. Mendoza is leading efforts to diversify the donation of biospecimens. Can you please explain what the All of Us research program is about and the great need for the donation of biospecimens, not only from Latinos, but other populations of color? I think you're muted, Martin.
Oh, sorry. There we go. So thanks, Dr. Ramirez, for that introduction and for the invitation to be on this panel. So excited to be here with my fellow panelists. For anyone that may not be aware, you know, the All of Us Research Program is an effort to bring together at least 1 million volunteers that reflected the diversity of people living in the United States who are volunteer their health data for at least 10 years. And hopefully longer than that. And so when I say volunteer their health data, what does that mean? So that means biosamples, as you were just talking about, Dr. Ramirez. That means blood, urine, or saliva in the case of All of Us. It means Fitbit data, linking electronic health records, providing physical measurements such as your height, your weight, your blood pressure, and answering surveys. So these all help to create a whole picture of health. And of course, the participant can choose which of these health data streams they'd like to donate. And so the All of Us program, as you might expect, is open to people both healthy and sick from all communities. And so unlike a single research study that is focused on a specific disease or population, All of Us is really meant to serve as this national research to inform thousands of studies covering a wide variety of health conditions. So we like to say we are quote unquote disease agnostic. Importantly, when someone decides to contribute to All of Us, it makes it possible for both that individual and their community to be represented in medical research. As you may know, All of Us is led by the National Institutes of Health, NIH, and it's the cornerstone of the Precision Medicine Initiative that was launched in January of 2016 by then President Obama, with the goal of moving forward the promise of precision medicine. And so we really believe that All of Us is among the most ambitious research efforts that our nation has ever undertaken. But even more importantly, All of Us doesn't work. The program doesn't work if we don't get those diverse biosamples and those diverse health data streams from Latinos of all backgrounds and people of color from all various populations. It's really, as the name implies, it's a program meant to focus on diversity and to address the health disparities that so many populations have experienced, and to move us towards that promise of health equity and precision medicine. So again, it doesn't work without diverse participants joining the study. So that's really a summary of the All of Us research program, and I look forward to our discussion with the other panelists today.
Great. Thank you so much, Dr. Mendoza. Appreciate those remarks. Our next speaker is Alma Lopez. She is just an amazing volunteer for us here in San Antonio. She's a thriving cancer survivor. And so, Alma, please share with us your cancer journey, what your challenges that you faced, and how you ended up participating in the All of Us research program.
Yes, good morning. Well, it's been almost 15 years, well, 16, that I've been a breast cancer survivor. At the beginning, it was very, hard for me, not knowing what to do, being afraid, especially when you have small children. But, the help of everyone, especially at the CTRC, giving all that warmth when you go in there, it helped me to go through the whole thing and not be as scared as I was at the beginning. And it's been, great. There's a lot of challenges, especially now that I see other members that I know that have gone through a little bit even worse. Fortunately, mine was diagnosed at a point where it was not so bad as other members that I know. But it was a real great deal of dealing with family and work. But I guess having a lot of faith and going on helped me out to come out. I was involved in the research at one point that I was working at one of the facilities. They came in and to do blood samples for that, and they did explain what it was going to be, and I decided to join in and help out as much as I could by donating. And I encourage a lot of, especially the Hispanic, that we're always having these afraid, I guess you could say, to everything, but we need as much as we can so we can help each other by getting all these medications that will help us, especially as the years go by.
Thank you so much, Alma. And Alma, what helped you overcome any fears that you might have had about donating?
Well, it's my parents. They were always afraid of trying new things out, especially when it came to vaccinations or anything like that. So it stays in our minds, to decide something like right away. You need to look at all the side effects when doing stuff that is new to your body. And so that, had me thinking about it all the time. And then I said, well, we have to have some kind of research to it so it will help, everyone. And so we need to help out as much as we can and put all those things aside sometimes and help out.
Great. Thank you so much. Okay, we're going to now open it up, and I'll be asking you some questions, and we're also, please include your questions in the chat. We'll try to get those questions from our panelists answered as well. So Dr. Ewing, I wanted to maybe go back to why was Genentech so interested in doing the Alliance program for inclusive research? What kind of convinced them, or what encouraged them to get involved in this area?
Yes, thank you, Dr. Ramirez. And Dr. Ramirez is referring to our Site Alliance initiative, which is an initiative that launched in about 2021 in partnership with 4 cancer sites across the United States. So those sites are located at the University of Alabama at Birmingham, O'Neill Cancer Center, City of Hope in Duarte, California, Mays Cancer Center in San Antonio, as well as West Cancer Center in Memphis, Tennessee. And that partnership launched because it was it was really an opportunity to recruit more underrepresented and diverse populations into our clinical trials to ensure that at the end of our clinical trials, when we have our products, that those products, again, are safe and efficacious for all populations, especially those populations that are historically and traditionally underrepresented in research. So we wanted to ensure that we were conducting research that would benefit everyone at the end of the day. And we identified those 4 sites to start with, because those 4 sites had done a phenomenal job of recruiting and retaining underrepresented and underserved populations. And those sites were also characterized with a host of experts who were adept and skilled in building partnerships and relationships with underrepresented populations. And they were also some of the nation's leading experts in health equity and health disparities research as well. So that was really the motivation behind starting the Site Alliance. And again, going back to the fact that we recognize that achieving health equity will require genuine, true collaboration, and it's a team sport. And we saw the Site Alliance as one of the mechanisms to deliver on that.
Well, thank you. No, and the Alliance is producing some amazing products that we hope to share with a number of other institutions as well. So thank you so much. Dr. Mendoza, for the All of Us program, how will you use the data that's collected, and how does that really improve health? Can you share that with us? And what do you know, how are the biospecimens collected and stored? So a couple of questions there for you.
Yeah, thanks, Dr. Ramirez. So biospecimen collection storage. So we really believe in giving participants multiple options. As far as the types of specimens we collect, we like to focus on blood, but participants also have the option of urine or saliva, and they also have multiple ways to donate. So, for instance, some participants are eligible to have saliva kits sent to them. Other participants can go to their local Quest location and donate there. There's also the option we've partnered with multiple healthcare provider organizations, and so when a participant goes in for a medical visit, they can donate there. And then we also have what we call our mobile our mobile exhibit, our mobile engagement asset, which is a set of 3 different traveling vans. So one for the West Coast, one for the East Coast, and one for the middle of the country. And these mobile vans allow members of the community to join the All of Us research program. So participants, at least on 2 of the vans, can donate blood, urine, and saliva. They can answer surveys. They can go through the full consent. And so this is really an option to bring research to the communities, especially for those folks that aren't able to, for instance, go to their medical provider to donate a blood sample. As far as what happens to these biosamples once a participant decides to donate, so the biosamples, as you can imagine, are de-identified. So all sort of personal data is coded and stripped for when it is shared with researchers. So for example, for blood and the other biosamples, these go to the Mayo Clinic, where they are stored in large -80-degree freezers. So all of us will use these samples to create what are known as whole genome sequence data, and so this data again is de-identified, and then it is made available to researchers to study a variety of health conditions. So again, all of us is disease agnostic, and so we leave it up to the researchers to decide what particular area of research they want to focus on, whether that's cancer or diabetes or Alzheimer's. Maybe they want to study health disparities. They want to study wellness. Really, the beauty of the All of Us research program is that it enables the study of multiple dozens, if not hundreds of diseases and conditions and wellness. And so again, the program doesn't really work unless we have folks that are willing to participate, diverse folks such as Latinos, African Americans, Asian Americans, Native Hawaiians and Pacific Islanders, hence the name All of Us.
Okay, no, thank you so much. And it's the first of its kind, is that correct? To collect this large volume of samples.
Yes, so there have been other large cohort studies, such as the UK Biobank, that have focused on a subset of the type of data that we collect. But the beauty of the All of Us research program is that we're not just focused on biosamples. Biosamples are obviously at the core, and they're a critical aspect of the program. But as we know, it's not just genetics that affects one's health. It's their environment, the social determinants of health. And so in order to get a picture of someone's health and sort of what are the factors that influence their health and or their wellness, you need that complete picture. And so that's why we collect all sorts of data types, as I mentioned earlier, to form that complete picture of health. And so that when researchers study All of Us participants, they're not just looking at just the genetic factors. They're looking at, again, all the factors that influence the health of Latinos and other populations.
Great. Thank you so much. And I have a question from the audience. One of them is the questions that oftentimes community members who have want to know who's going to have access to their information. Will they have access to their own information? And will the donor, and if so, will they have access to support services like genetic counseling? And will this service have a cost to it, or or does the client's insurance have to pay? And what if the client is uninsured? So there's several questions there. But so what happens after you donate? Will that information come back to you? And if you need help, what happens? So Dr. Ewing and Dr. Mendoza?
Yeah. Did you want to start, Dr. Ewing? And then I can go.
Dr. Mendoza, I'll yield to you, and then I'll follow up after your response. Okay,
great. So to answer the first question, yes. So one of the core values of the All of Us research program is what we call return of value to our participants. So we don't want this to be a one-way street where we just take data and then the participant never knows what happens to it. So we want to make sure that we are providing value back to the participant. So one of the ways we do that is through a return of information. So if a participant elects to donate blood and or saliva, what we're able to do is we're able to return two types of information. So the first type we return to them is what's known as ancestry and trait information. So this is information that focuses on genetic ancestry. Where have your ancestors come from? Something similar to like what you might get from 23andMe. We also offer information about traits. So like, do you like to taste the cilantro? Or does it taste like soap to you? Is your earwax wet or dry? Pretty gross, but we offer that. Are you lactose intolerant? So we offer these kind of interesting little factoids to folks. And then in December of 2022, the program took a really huge leap to start offering what we call genetic health-related return information. And so we offer two types of information there. One is we offer what is called our hereditary disease risk report. So this is just exactly what it sounds like. So there are a list of currently about 59 known genes that are linked to hereditary risk. So for example, BRCA, BRCA, folks are known if you have a certain mutation in that gene, you're more likely to develop breast cancer. And so that's a test that can, a genetic loci that can easily be looked at. And so we offer this disease risk report based on these 59 known gene loci. We also offer a report called Medicine in Your DNA, which can predict your response, particularly if it'll be effective or not to a particular medication, and that may help to inform which medications may be relevant for you. And so this is all a way that we provide value back to our participants. Now, importantly, you mentioned genetic counseling, Dr. Ramirez. One of the really unique aspects of the All of Us research program is anyone who receives their genetic calculated return of report results. So that means their hereditary disease risk and or their medicine in your DNA report is eligible for free genetic counseling. It's completely free, no strings attached. And in the case that someone receives a pathogenic result, such as positive for BRCA, the participant will not be able to view that report on their own, and instead the report must first be viewed in the presence of a genetic counselor. So it is required, and again, it is free. Additionally, if a participant decides at some point, you know what, I don't want to participate in the All of Us research program anymore, that's fine. We're happy to accommodate that request, and we will remove their data and destroy their biosamples from the program. So for us, it's all about giving the participant choice and value about how they want to interact with the program. And so I'll pass it over to my colleague, Dr. Ewing, for any remarks you'd like to make.
Thank you. Great comments. Dr. Ewing? You're muted.
Oh no, it's going unmuted on my end. Can you all hear me?
Yes.
Okay, all right, awesome. Thank you, Dr. Mendoza. And I will share that I will answer this question not necessarily as a Genentech representative. So I just want to disclose that I am trained as a genetic counselor, and I do have the pleasure of working closely with the All of Us research program, leveraging that genetic counseling skill set. And I think the beginning of the question inquired about who will have access to the data. And I wanted to also speak to the researchers workbench that is available for researchers to go through rigorous training and meet stringent requirements in order to access the data that is available through the All of Us research program. And this is really an opportunity to help avail data and this asset to scientists and to researchers who may not have traditionally had access. So All of Us has been very diligent in ensuring that it's partnering with historically Black colleges and universities, minority serving institutions, and other institutions to ensure that the biomedical training pipeline and researchers at those various institutions will also have access to the data. So I wanted to share that information as well.
Wonderful. No, I know that All of Us has taken amazing precautions. We've learned from a lot of different studies, and really to protect the patient and their data. There's a general question, again, back to both of you in terms of how does the general public made aware of the All of Us initiative? That we have Dr. Mason here from, I believe, the San Antonio area, wanting to know how they can get more information both to their African American and Latino patients.
Yeah, I'm happy to take that, Amelie. So All of Us has a number of outreach and engagement efforts. So obviously we have 2 websites. So there's each one is focused on a specific sort of population, if you will. So there is joinallofus.org, and that is if you want to become a participant in the program. So we encourage you to visit that. If you want to gain access to the data, we have another website called researchallofus.org, and that's where you can become a registered researcher to see if the data available at All of Us will help to inform your study. We have multiple partners that we link up with, including multiple minority-serving institutions, historic Black colleges and universities, Hispanic-serving institutions, and really we have a strategic way of looking at our partnerships. So we're really looking to partner with trusted voices, organizations that know their communities the best, because obviously that's not we can't be everything to everyone. We don't know communities the way that local organizations do. And so we really want to partner with them so they can be our guide, to engaging with the community and hopefully starting to build a trusting relationship with the community. And so for anyone that would like to partner with us, you can just visit allofus.nih.gov. So I guess that's the third website. And we have a section on there focused on partnerships, for ways to connect with the All of Us research program.
Great, thank you. And then we also have another question for you, Dr. Mendoza, from Mr. Gonzalez Fisher. He wants to know that if a person has a genetic mutation related to a disease, does that change their status from healthy to pre-symptomatic individual? And will this individual receive some type of care?
Yeah, I think the important, so thank you for that question, Dr. Gonzalez. So the important thing to remember about All of Us is that it's a research program. And so whatever information, you may receive about your hereditary disease risk, because it is up to you if you want to share that with your physician. All of Us does not link that data back to your primary care physician. So whether you would change from a healthy to pre-symptomatic individual based on that disease risk report is completely in your hands as far as if you want to share it with your team of physicians. Importantly, because we're a research program, we are unable to offer any type of follow-up care. That's really outside the scope of our program and our remit. We've tried to have, because we don't want to leave people quote unquote hanging, we have tried to walk up as close to that line as close as we can. And so that's why we've decided to offer the free genetic counseling for anyone that requests it. But because of the nature of our program and restrictions that are in place, and again, because we're a research program, we cannot offer any type of healthcare.
Great. Well, this question is for all of you, but I'd like to start with Alma. Alma, we have a question from the audience. And in your opinion, having been a patient, what do you think are the best ways for us to reach our patients, to educate them about the importance of biospecimen? And then I'd like to then ask our panelists, what strategies have you all been using? But first, Alma, just top of mind, in your opinion, in communicating with family members and so forth, what do you think is our best approach for scientists to try to reach the community?
Well, I would say, giving more like workshops that I will explain to them what it is and answer all their questions, like the ones that I had, if it's, that scariness that you always get, and knowing what we are doing, what is the outcome, having more communications with them in workshops or in a class or giving them some pamphlets that would have all that information to answer any questions or any doubts they might have.
Great, thank you so much. And both Dr. Ewing and Dr. Mendoza, what kind of approaches are you all using from your organizations to reach out to our diverse populations?
Yes, and I'd also like to tap into my genetic counseling skill set here as well. But I think it's critically important to reach each patient, each family, each population where they are. And as Alma said, lead by addressing any concerns that individuals may have around biospecimen, biosample donation, helping to educate individuals about the importance of biospecimen donation and some of the benefits that may result from donation, but also being very truthful and highlighting the limitations as well. But I think it's also important to, again, like know your patient, know your family, know your population, because there may be certain cultural nuances around biospecimen donation that needs to be addressed and worked into the conversation as well. And I think that's, again, where you tailor the conversation to meet each patient where they are, to provide them with the information that could be critically important in helping them to make informed decisions.
Great, thank you. Martin, any additional?
Yes. Obviously, working with communities and building that trust is something that is critical to the All of Us research program. And so, we've been very innovative in that area, in the sense that we have, I think we're probably one of the first, if not the first, research programs to create what we call a division of engagement. And so the purpose of this division is not to enroll members of the public into the program. It is more focused on outreach and awareness and education, and building that initial link and trust with the community. And so what we've developed is what we are calling our engagement ecosystem. And so really we like to think of it as a network that is, national scale, and local in focus. And so we have multiple partners that focus on specific populations based on their areas of expertise. And so what we're really doing through our engagement division is we're working directly with communities to create safe spaces for important conversations about history. So for example, back in I believe it was January or February, and Dr. Ewing was there as well. The All of Us research program held a community engagement event with the community of Tuskegee, Alabama, to talk about the U.S. Public Health Service syphilis study and the effects that had on the local community, and how it's the hesitations of participating in research, and to educate them about the All of Us research program, but more importantly, to acknowledge the historical events that unfortunately happened, and to illustrate how the All of Us research program is different, and how we're trying to move forward while acknowledging those past events, towards building a better relationship with the community as far as biomedical research goes. And so really, our main strategy, as I talked about earlier, is working with trusted partners, trusted voices that know their communities the best, and letting them be the guide for us to engaging with the community.
Right, and that's something we really learned. We knew before, but it was even emphasized more during COVID, that the reason we were able to mobilize our communities to get vaccinated was because we were working with trusted sources in the community. So that's extremely important. And the other thing I wanted to just throw in is that the Latino population, or Hispanic population, is a very diverse population in terms of their ancestries. And this is why it's important to know as much as we can about our community, because we range anywhere from European to Central African to Native American, kind of in the middle, or a blend of all of those. And so, right now, because I think less than 4 to 6% of Latinos participate in clinical trials, we just do not have that diversity. And so, Alma, how would you, again, convince your family members or others in the community to participate in these kinds of research programs that ask you to donate, a sample?
Well, I guess getting as much research that I can explain to them, if they're not able to go to a workshop, or sometimes even on a lot of literature, reading literature, getting them as much as I can bring to them, or to other families who cannot travel to a workshop, and just getting as much information that I can so I can give it to them.
No, a lot of people tell us that I get my information from my family or friends, you know, and so helping them navigate and helping them get more information to
Yes.
participate is extremely important. So great, thank you. Dr. Ewing, you know, how can we get our healthcare systems more involved to increase their knowledge, attitudes, and behaviors around biospecimen donation?
Yes, in terms of engaging the healthcare system, I think it's really seeing each, if you're in the healthcare system, seeing each patient, seeing each population, seeing each research participant as an equal, and recognizing that there is something that you can learn from each and every encounter as well, and taking those learnings and allowing them to help inform and guide your practice moving forward. I think it's also important for us as humans just to realize that there is always something that we can learn, and there's always something that we can do better to increase our ability to reach and effectively treat and meet each patient, family, participant, and partner where they truly are. And as you may be aware, there's really a host of materials available now to help individuals become more culturally competent, to understand some of the myths and facts around research engagement of various populations. So just having that eagerness and that curiosity to continually learn and improve, I think is one of the main ways that we can better engage the healthcare system in helping us to eliminate inequities.
Thank you so much. Alma, in terms of going back, you know, from your perspective, you had breast cancer, you're a thriving survivor, but before you got cancer, did you know about biospecimen donations? And if so, what did you think about it?
You know, as I think back, I don't think I really heard that much. I was too much into my children and school and all that. And I don't think I paid as much attention until, you know, I got to that point where I really had to, even though I had other elements that I needed to search on, but I never really took the time. But once I was diagnosed, then I really wanted to read as much as I could of all the medications, of all the side effects, you know, all the fears that I might had in my head, everything that could help me out, and of course my physical and mental being. And so, yeah, no, I never really took a lot of matters into that, you know, or I guess I never really paid attention.
What would you tell doctors who are seeing their patients to encourage them to donate?
Well, to, I guess, get them out of that fear, always talk with the truth. I think one of the doctors mentioned that, you know, always not hide anything from them, that, you know, they would have this little doubt, even the little doubt in their minds. And then, of course, you know, giving them as, like always, just giving them as much information that they can understand, not as a medical information, because sometimes, you know, all these wordings and all that, sometimes we don't understand, especially I'm talking about my background family. And so anything that could be easy for them to understand what they are going to be doing, and it is for their well-being.
Good. Well, thank you. I think that's, you know, so important. Dr. Mendoza, what are some of the latest technologies that you're using to recruit and collect or monitor your participants? And I wanted to comment that one of the items in the chat is that some of our participants are saying to really call our participants research participants and not patients, even though they may have had cancer and they have been a patient. They think that, for clarification, that we that if they are participating, we should call them research participants. Any thoughts on that?
Yeah, so to your immediate point, Dr. Ramirez, in the All of Us research program, we actually don't refer to them as patients or research participants, but we call them our participant partners. And we do that because we truly view them as partners in this journey. And so we do our best to back that up with real action. So what do I mean by that? That means that that folks who choose to participate in the program have the option to become what are called a participant ambassador. And so if you're a participant ambassador, you have the opportunity to serve on various governance committees within the program. So our executive committee, our advisory panel, and other similar advisory groups we have. Just like any large research program or any really workplace, we have working groups that are created to tackle specific initiatives, specific issues the program is facing, and so normally, that's the members of those working groups are in general NIH employees, but but we've made a point of offering the opportunity to participant ambassadors to join these working groups. So they're really getting down into the nitty-gritty of the program, how it operates. We also have a annual or biannual meeting every 6 months or so called our All of Us Face-to-Face, where many of our partners, our researchers, the program governance, the NIH staff all get together to share updates and go over the progress of the program. And participant ambassadors also have that option to attend that meeting as well. And it's normally several hundred people, so it's quite large. As far as technologies that we are using to assist participants joining the program, we have a number of things, a number of initiatives and policies. For one, all of our materials, our website, it's not only available in English, but it's available in Spanish, and that's a policy of the All of Us Research Program. We have something called CATI, C-A-T-I, Computer Assisted Telephone. I forget what the I stands for, but what this basically does is for someone that that may not be as technology savvy, it gives the option for a live human to interact with the participant partner to help them as they fill out any of the number of surveys that we offer. And of course, I talked about previously our mobile engagement asset, our MEA, our 3 traveling vans. And so I look at these as technologies also because it enables us to meet our potential participant partners where they are in their community, especially those that may not be able to get to a blood bank donation site. So we're really focused again on trying to meet people where they are.
Great, thank you. I just wanted to make a comment. We have a couple of community health workers, Ms. Evangelina Ramirez and Armida Flores, who are community health workers themselves, and they do an amazing job and are one of our most trusted sources of how to get information out to the community. So thank you for that reminder and the importance of working together, both with our community organizations, our academic partners in helping get the latest and most important information out. Dr. Ewing and Dr. Mendoza, if you might want to comment as well. Once you get these specimens first from a pharma industry and then maybe from a research organization, how does the pharma utilize the information it's gathered to come up with the latest treatment for options? I know it's a big question, but just an example of kind of the pipeline.
Yeah, so some of the information that is gathered through our research protocols, it's going to be informed by the protocols that are approved by institutional review boards, approved by ethics committees. So we have a plan in place that will guide the questions that we are asking, the information that's being collected, and even how that information is being shared and leveraged moving forward. So there are protections in place. And when we can, as a pharma partner, we are collaborative, but there are some instances where it may be business specific and even pharma partner stakeholder specific as well.
Great. Dr. Mendoza, from a research and academic perspective, how are the biospecimens being utilized?
Yeah, so the primary way right now is through when we receive a biospecimen, that first we code the personal information so that so that staff do not have access to this personally identifiable information, and then we run in most cases a whole genome sequence, and this data again is stripped of identifiers, and it goes into a research database called what we call our research hub. And then so in this database lies not just the DNA information, but it also includes survey responses, again, which are de-identified. It includes Fitbit data, again, de-identified. It includes physical measurements, and I think I already said survey response, and as well as if a participant chooses, they can also link their electronic health record. And again, it's stripped of all personal information. And so what this does, as I mentioned at the beginning of our webinar, is it creates this entire picture of health. And so this data is in our research hub, and then it's made available to researchers that are required to go through a number of vetting processes before they get access to that information. And it is really the researchers then that will take the ball and are responsible for translating the information into research discoveries and eventually medical products. So we're really providing a platform for researchers to study health, wellness, and disease.
Great, thank you so much. And we're getting near the hour, so I just wanted to maybe ask you all to give a short, maybe 30-second comment in your any additional thoughts that you'd like to share. And I'd like to start with Alma, and then with Dr. Ewing and Dr. Mendoza, and then I'll have a few comments to wrap up. So Alma, any last minute thoughts that you'd like to share with the audience?
Well, first of all, I want to thank for inviting me to be a panelist, and well, to give it all we can to help everyone who needs help, especially those who are going through what I went through. And so help by doing the research.
Great, thank you, excellent. Thank you, Dr. Ewing.
And very similar. Thank you very much for the opportunity to speak today. And as I highlighted, Genentech Roche is truly committed to advancing inclusive research and doing so in partnership. And at the same time, yes, we are a pharma biotech company, but at the end of the day, we are humans, and we are also research participants, and we are patients, and we have family members who are affected as well. So I encourage people to continue to hold us accountable, and to please be open to partnerships so that we can work collaboratively to deliver on health equity. Thank you.
Great, great. Dr. Mendoza?
Thanks, Dr. Ramirez. Again, just want to echo my thanks for the invitation to this panel and for being able to be on here with such wonderful panelists and a great moderator. I would just echo that we cannot advance health equity unless we have diverse participation. What I often tell my family members that are hesitant to join clinical research or clinical trials is that you can choose to sit on the sidelines, but remember, when that medication comes out, you will be sort of participating in an unofficial clinical trial without all the protections of a real clinical trial. And so to me, that's not the situation that we want to be in. So I encourage everyone to to do your research and to look at clinical research opportunities that may be a good fit for your current health status. So thank you again for the opportunity.
Oh, and thank you. And our population's becoming more diverse. We need to be leaders in this area and choosing the right care for ourselves and wanting to make sure that treatments and medications that are available will be the right ones for us. So let's definitely all gather and participate. I just wanted to again thank our audience for being with us, for sharing your questions with us. It was great. I think it's really important to hear from our healthcare professionals and survivors as we come up with new ways to diversify, our research in clinical trials. And I wanted to share something that we have here locally in San Antonio or its surrounding area. And this is to talk about a study where we're enrolling, 1,500 Latinos to participate in a study. And we need you, it's Latinos who have had cancer within the last 5 years. And so we would love to see you join us. There's the email here on the slide, caminos@utesca.edu, where you can reach us for more information. And we also encourage you to, contact our team. If volunteers are eligible, we do have a small stipend available for each of your participations. You can find out more about us also on our Salud website at salud.to/survivorship study. And last but not least, we wanted to thank our Genentech sponsors for enabling us to conduct this webinar series. We're really excited. Again, there's more information about clinical trials that's available both in English and Spanish. So please join us. And then last but not least, for wherever you're from, we are going to have a conference in February of 2024. That's looking at advancing the science of cancer in Latinos. And we'd love for you to join us where we really discuss and go in depth about different Latino health issues. And some of our panelists today will be part of our session and presenters as well. So thank you all so much for joining us. We're very grateful for your time and have a wonderful day. Take care.
Thank you.
Bye-bye.
Bye-bye.